good GPA, but a lack of substance in that. Well, it took me, I have a GPA of 4.0, but I went through Clemson, it took me 10 years, because I took one course. I appreciate the 4.0, but that's, you know, we break things down. And what you need to do is to be sure you're challenging yourself in college to be successful in med school. It's not the other way around. You're not trying to get out of working college so that you can be successful in med school. That's the wrong way to look at your college career. So you don't need to shy away from courses. You need to take courses that are going to help you, that have good teachers, but that challenge you, and that can be used as a yardstick for your success in medical school. Not to mention being the safety net of something that you may see in med school. And I'm going to get Jeremy to comment a little bit on the first 2 years of med school, just kind of as a consequence to that kind of introduction. But before I get him to say one thing, I want you to just kind of get a sense of what this application is about. Please connect with your pre-med advisors. Please understand they have a lot of information to help guide you. Their committee scores and different colleges, I go to Walker, go to Francis Mary and whatnot, they have different techniques, but they are common to the fact that the pre-med advisor works on committee letters of recommendation that helps us tremendously. Okay? So make that connection. Understand, don't not be informed of kind of what I'm saying tonight and how that impacts, for example, since I'm at Clemson, in the Clemson curriculum and how that's going to help you be successful in medical study. The interview is a whole different kettle of fish. We look at communication skills. We look at the ability of humility and empathy. We look at the ability for you to be able to convey, like I said a while ago, the validation of why you want to do this. Okay? It's hard for me to give you the blueprint exactly of a medical school interview, but certainly some of those salient features I just mentioned are going to be common probably to all interviews. Sometimes they're going to ask the medical current event questions. Sometimes there may be ethical dilemmas. How do you handle that? Sometimes they're going to talk about what's the worst thing you've ever done in your life? Of course, one of my trick questions is, Manny, coming into this interview with me today, what was the one thing you didn't want to talk about? Don't you love that twist? You know, and they say, oh gosh, I didn't want to talk about it. Name's making me talk about what I didn't want to talk about. So, I mean, the trick is we have these little techniques, but if I had to give you the commonality among the successful interview, or amongst those who are being interviewed, I would say two things. Come in prepared and come in honest, and you'll be fine. Come in prepared and come in honest, you will be fine in an interview. Nerves can take you apart, and it's unfortunate sometimes. And you have to understand that yes, we're interviewing you, and yes, it's tough, but we're on your side. We are not against you. It may appear that way. Jeremy always thinks I'm always against him. That's a different story because it's true. But in the interview process, we are really on your side. Okay? So that's kind of the intro. You look at the number of students at our school, breaking down, let's say the 95 that are on the 90 in the class right now, I'd say about 30, 36 are from USC. Clemson is next with about 19 students. Next is Walker with about 15 students. And then other colleges throughout the state and across the nation, because once again, you can be from South Carolina but go to Boston University and you're still a South Carolina resident. So, you know, you're a state applicant in terms of med school. Okay? All right, so that's kind of the intro. I'll get Jeremy quickly here. And like I said, if you have to go, feel comfortable leaving, we're here for you. But, you know, it won't upset us at all. Again, we appreciate your attention. We know you've got a lot on your plate, but we will stay here and answer any questions that you may have accordingly. Jeremy, you want to comment a little bit on the Clemson student perspective of the move to Carolina and maybe that first semester?
Okay. So I think Dr. Stallworth kind of made the point pretty clear that the move from undergrad to medical school, it wasn't really that anything was so much harder than anything I'd done in medical school. It was more or less the pace and the volume of material. Everyone kind of had that feeling the first week was, oh my God, what have we gotten ourselves into? I remember sitting, and we have a lot of small group interaction at USC. That's one of the things I like about our school, where we kind of break down our classes into groups of maybe 8 to 10 students. specifically a course called Introduction to Clinical Medicine. I remember we were talking about how our classes were going, and we all just kind of sat there real quiet, and someone said, "Why did we do this again?" And that was just the first week, but obviously we all got over it, or most of us at least. And it's just something you got to prepare yourself for, because medical school is hard, but it's nothing that you can't handle. And that's why when we interview people, I'm on a admissions committee as well, we're looking for that maturity factor. Has the applicant challenged themselves in undergrad? Because it's a real shock no matter how much you've done in undergrad. And when you come to at least USC, curriculums differ depending on what school you're at, so that's kind of a caveat there. But so I'm just talking about USC. First semester at USC, you're going to be taking gross anatomy, biochemistry, histology / kind of cell biology, and introduction to clinical medicine, which is kind of a hybrid course. It's kind of hard to explain introduction to clinical medicine. It's a little bit of everything. You get everything from nutrition to, you get some psychology or psychiatry in there. Help me out, I'm blanking.
Well, part of ICM when you get sex education, because I teach that. I'm sexpert, got it, in addition to being here. So if you have any personal questions, I'll help you with those one-on-one after this is over, okay?
So ICM is actually a course you continue on, so I'm still in ICM. So that actually ends up feeding into where you learn how to take a history, where you learn physical diagnosis, you learn how to do a physical on patient. You meet your senior mentor through that program, which is a program that, as far as I know, is still completely unique to USC, which is where each pair of students will be assigned to either one senior citizen in the community or a couple, and we'll have 3 or 4 assignments, maybe usually only 3 or 4 a semester, and we'll go out into the community with them, and we'll maybe have to go do a nutritional assessment of our senior mentor. And every time we see them, we take their blood pressure or whatever, and it's kind of our first patient. And what's unique about that is most first and second year medical students don't get to see a patient. And while that's not technically a patient, it's not on the wards, it's not, with Dr. Stallworth breathing down your neck while you're, examining a patient. It is something where you're out of the classroom and you get to actually put your hands on a patient, and you get to do something where you start to remember why you're here. The other thing you get to do first semester is you get to do a preceptorship through ICM. You get to go, and it's essentially shadowing a doctor again. But it's an afternoon again where you get to get out of the classroom. And except this time you're not shadowing as an undergrad, you're shadowing as a medical student, and a little bit more is expected of you, because now they're expecting you to know a little bit, they're expecting you to maybe understand a little bit more. And so while you don't know anything at that point, and I would argue that I maybe still don't know too much, at least I don't feel like that sometimes. It's nice to finally be a medical student and following and attending around. But what Dr. Stallworth was talking about, the safety net, mine was biochemistry first semester. I took that in undergrad, and that was one of my harder courses. And so it was nice to have that. When you have gross anatomy, which is an animal, having something like Dr. Smith talked about, not Dr. Smith, Dr. Stallworth.
Yeah, it's a long walk.
Having something like that you can kind of fall back on was nice. And then you move into second semester and you pick up physiology, drop histo, and do second semester biochemistry, and you continue with ICM. And physiology is also very challenging, but probably my favorite course, because the body's just so cool. And if you don't think it's cool, you're going into the wrong field. Because, we can't design a better machine than the human body. We build cars that last for what? Cars these days last maybe 10 years. But we have human bodies that last 80, 90, 100 years. That's amazing. Yeah, they wear out, but we can't build anything like that. We have hearts, that are pumping non-stop every day, and that thing doesn't wear out in a normal situation. That's phenomenal. You know, so for me, physiology was an absolutely amazing course. It's challenging, but it's so interesting. And that's what I love about medical school, and I'm off on a tangent now, but, you know, as challenging as it is, you're going to love it. So that's your first year.
And then you have the ultrasound curriculum, which is also part of the ICM, because we're one of 2 schools in the nation that teach you ultrasound. And there's a lot of people that think that ultrasound is going to replace the stethoscope. Because now they've got these these things down, and you get so much information with the ultrasound. So we teach ultrasound as part of our curriculum, which is part of that intro to clinical medicine too. And it's a 4-year curriculum that fix that kind of constructed so that when you get out, you have a working knowledge of ultrasound. Okay, that's kind of the neat condition, some things Jeremy talked about. When you move to your 2nd year, then you pick up some of these other basic science courses. That's where Jeremy is now with pharmacology and some of those pathology and some of those other courses. And the real trick is to get through the first semester, to get into that routine of recognizing what it's about, adjusting to it, and once you get going, you know, it's challenging, but you're going to be successful. You come to the 3rd year, as I mentioned, I'll get Dr. Bacon to comment in a second on the 6 clerkships and kind of the successes and or failures in the clinical years.
Okay. Well, I'm pleased to be with you all tonight, and I'm sort of a newbie in the recruiting process and the information process for the University of South Carolina. I grew up in Florida, and I went to college and medical school in Florida, but I came to Columbia and did my residency, and then I joined the faculty. And I've been on the faculty of the OBGYN department at USC School of Medicine longer than I lived in Florida, so don't do any calculations while you're listening. I do obstetrics and gynecology. I'm not on the main campus, but I'm in the hospital setting where you'll spend a lot of time, and that's at Palmetto Health Richland. Jimmy may teach sexology, but I'm the one who's going to talk to you about birth control in the clinical, practical sense, so don't have one without the other. We have to say that. Good. I've already been prepping Jeremy on the way up for some practical tips for his pharmacology exam. But when you finish the first 2 years of med school, then you're going to spend the 3rd year mostly doing clerkships, and you're going to spend either 6 or 8 week rotations doing all of the primary care clerkships. You're going to do pediatrics, obstetrics and gynecology, internal medicine, you're going to do general surgery, you're going to do family medicine, you're going to do psychiatry. But USC has set up a plan for the 3rd year so that you get several 2-week windows in case you think that already you might be interested in ophthalmology, you might be interested in neurology, you might be interested in rehab medicine, or something that's not one of the basic 6. And therefore, you're going to get the opportunity to begin to mentor with someone in that field so you can get a little better idea of what you want to go into. Then you can build on that in the 4th year where you have some required time in clinical care, such as senior medicine and senior surgery. But you'll also get to begin to meet with the faculty of the department that you're interested in going into for your residency and your career, and you're going to be able to pick some of those electives, both at USC or possibly at a place you want to do your residency, and you're going to begin to focus on some ancillary clinical rotations that are going to help you prepare for your residency training. So everything you do in college builds a next step towards medical school. And I want to echo too that those courses you can take here that are not absolutely required for entry to medical school, but mimic and prepare you for some of the courses in medical school, such as physiology, such as any type of comparative anatomy that's offered. Anything like that is going to give you some speaking acquaintance with the course, biochemistry, so that when you get to medical school, you're going to have a little bit of familiarity, and it's going to help you hit the ground running. The other thing I'd like to say is everybody was touching a bit on the interview process, and we've got to have the nuts and bolts, which are going to be your grades and your MCAT scores. But the other thing that the committee is trying to discern, and the 2 individual interviews you have are trying to discern, is they're trying to see in your eyes that this is what you want to do, that you want to care for people.